to episode 11. I've been doing this for 11 weeks since this all started of our Be Resilient and Healthy During COVID. And today we're going to talk about healthy skin while wearing the mask and skincare with Dr. Theresa Conologue. I am so happy that she's here to join us, and we're hoping that we can get to hear her later, because I don't think I can do the slides on my own, but I can, maybe we can figure out something, and maybe you can sign in or sign out again, Theresa. But I always start out with a quote. Be thankful for what you have. You end up having more. If you concentrate on what you don't have, you will never, ever have enough. I love this because now that the state is opening up in phase one, you really appreciate what you didn't have. And now that, you know, we having it again, we even just getting together with some friends, just playing some tennis and just talking to each other is so rewarding. So rewarding that, oh, I can hear you. It says connecting to audio, Theresa.
I just logged
So
in from my
I
iPhone. Can
wanted
you
to
hear me
add
okay?
some numbers and worldwide. I didn't do this before, but I wanted to add that. I remember when I first started doing this, when I first talked about COVID-19, we had at that time 129 cases in the U.S. But as of today, we have 5 million cases worldwide. We have about 300,000 global deaths. The U.S. Leads the number of cases at this point. At this point that you can see right here, the U.S. is about it looks like a million. And in the U.S., the area that the dark purple is the most dense area, and in Queens, Cook County, and Kings and the Bronx, all in New York, are the highest confirmed cases, followed by, you can see that in Los Angeles right here. You can see them down in Georgia here, but you see more density around the Northeast and in the Southwest area here. And daily confirmed new cases. This is the U.S. And so the U.S. is dark green. You can see that March 15th, we exponentially had a lot of cases. And looks like we're on a downward trend. This is the 5-day moving average. So it looks like we peak here, this is the U.S., around April 12th. And then we're slowly going down, but we're peaking and low and peaking and low. Now, in Virginia, the phase one was opening in May 15th. So it'll be interesting to kind of see where we are heading. Are we heading downward here, or are we heading more of upward trend when the states are slowly opening up? And you can see Italy is this purple area here. They had spiked. It has spiked, but then they're now flattening the curve. All these countries are flattening the curve, except for the brown one looks like to be Spain. So we are still way up here in cases, but then again, we are testing more. So we don't know whether these countries are testing as much as we are, but we just are testing more now than we did in the beginning. So let's look at Virginia. This is the data from the Virginia Health Department. As of, this is really 5 p.m. yesterday, on May the 20th. Its total cases in Virginia is 34,000. 4,000 right now be currently hospitalized, and so far we have almost 1,100 deaths. And this is cases per 100. As you can see, the density here is more in Northern Virginia. This is where we are in Spotsylvania, right here. And most of the cases are in Northern Virginia, neck, and also in Richmond, where the density is 200 plus per 100,000. And confirmed cases, it looks like we peak around the beginning of May, and we're kind of slowly going down. However, with the opening in phase one, that started May 15, which is right here. So we're going to see the effect of opening more in 2 weeks from now rather than now. So these reflection right here that you see right here is a reflection of 2 weeks before. So as of May, let's say you have May 15th numbers here, whatever case is here is a reflection of what we did in social distancing and shutdown and work at home, of the reflection of 2 weeks prior to that, or like the beginning of May. So the numbers from phase one opening, we can only tell what we're doing with the phase one opening from 2 weeks from May 15, which is the end of May. And in our region, which is the Rappahannock region, which involved Caroline, Spotsylvania, Fredericksburg, Stafford, and King George, they are 1,100 cases. Currently, there are 130 hospitalized and 14 deaths, which is the same number as last week, which is encouraging. As you can see right here, age group by cases, the most of the cases it's in age group between 20 and under 60, what you see right here, which is consistent with the whole entire state at this point. I want to point out that female and male is almost the same. In other countries, you see more preponderances of male infected. However, male, there may be more male death than compared to female death at this point. And so this is interesting, where the 60% of the death in Virginia is really inpatient that are in nursing home that are in their 60s, 70s. But the majority of the case positive cases is really below 60. And this is what you want to look for. This is a very important slide, so stay with me here. So in Virginia, we want to see the percentage of those that are tested positive. So of those that are tested, about 14.4% are positive, which is a good thing because you have an 86% chance of testing negative with symptoms. And you want to see the number of people that are being tested higher. So you want this to be rising and you want this to be lowering. So that way we know what we're doing with social distancing, working at home, and just slowly opening up. We want to see this trend going downward and this trend going upward. And so this is encouraging. It looks like we peak around right here, and we should be seeing cases going down. So I'm going to be showing that for you every week to see if that is the case. Good news is from the CDC website, the virus does not spread easily from contaminated surfaces or animals. It used to be that we thought that they did a study that they found that the virus was on cardboard, on metal surfaces, and on wood, and sometimes it can stay for beyond up to 3 days. However, they found that the virus does not spread. It may be there, but it's inactivated. So touching contaminated objects or surfaces does not appear to be a significant mode of transmission. The main mode of transmission, again, is people to people. That's why in a dense area such as cruise ship, prison, classroom, congregation of groups that are 50 or more are dangerous at this point. So again, it's people-to-people transmission. So what that means is that you don't have to wipe down your food that you buy at the grocery store like you did before. Of course, you should still wipe down the chairs or the areas when you're sitting down, and always wash your hands and never bring your hand to your face unless you have washed your hands or disinfect your hands with alcohol sanitizer of at least 60% alcohol. And I wanted to put this up again. The date that we started phase 1 was May 15 with Forward Virginia on what is essential retail now is open with 50% capacity. Restaurants are open, but only only outdoors at this time at 50% capacity. Public entertainment, public amusement is still closed. Fitness and exercise still closed. However, you can exercise outdoors. Beaches are now for only exercise and fishing only under phase 1. Gatherings or 10-person limit. Teleworking strongly encouraged. Face covering is strongly encouraged, and I hope that you all do. Childcare is still open for working families. Drive-in places of worship is still drive-in only at 50% capacity. Personal grooming, which is getting your haircuts, and the barber is appointment only and wearing masks. And private campgrounds are now actually open. So this is a thing you can do for Memorial Weekend that is coming up. Overnight summer camps are still closed. State parks are day use only and, at this point. And schools are currently closed. And I think I remember this. And then we will have this. And the main part is now you can get a haircut. I'll show you a picture of me getting my haircut. So this is our new norm. This is in Washington, where the parks are open, but they draw out these, circles where you can stay in. You can't go beyond these circles. And that's me getting my haircut on Tuesday with my hairdresser, Nerese, wearing
That's
masks,
awesome.
getting a haircut, and getting my hair blow dry. And that's my son graduating from his master's program this past Saturday. This is the new norm. We're sitting in front of the laptop. He's wearing cap and gown. This is our kitchen table. My daughter covering her face. This is how we attend graduation. And congratulations to all the graduates, high school, even kindergarten, colleges, medical school that had that had to do virtual this past a week or so. Congratulations. It's been a difficult time, but that nonetheless does not diminish your accomplishment. And I'm so proud of these graduates. And again, I always think about the people that are in the front line taking care of us, which are the first responders and the ER doctors and nurses and staff. And I always show this picture. These are the staff at Spotsylvania Regional Medical Center. These are the pictures of the staff at Mary Washington. So now we have our illustrious Dr. Theresa Conologue, who works at Mary Washington Dermatology at the medical building next to Mary Washington Hospital. And I hope that you can have your audio on. Are you on?
Can you hear me? Can you guys hear
Theresa,
me?
can you talk?
I'm talking.
I still
Can you
can't
hear
hear
me?
you.
No, don't say that. Okay.
I still can't hear you.
No. Can anybody else hear me?
I thought I heard you before, but let me talk about your let me give you her biography. This is a amazing doctor. Dr.
So the
Conologue
audience
had her
can hear me.
bachelor's and majoring in biology and psychology in November 1995. She graduated summa cum laude at a GPA of 3.85. And then she went to the osteopathic medical school at Lake Erie College of Osteopathic Medicine, graduated in May of 2000. She was ranked 21 out of 120 in her class. And she's a board certified dermatologist since 2005. And she got recertification again in 2015. Her resume is about a book long, but she is a fellow in the American Academy of Dermatology, a fellow in the American Academy of Cosmetic Surgery, and a fellow in the American Society for Laser Medicine and Surgery, and a fellow in the American Society for Dermatologic Surgery. And so she also is certified in laser and cutaneous surgery as well. She's been the top doctor in Northern Virginia Magazine from 2012 all the way to 2017. And
Actually,
so
2020.
we are just lucky to have her here in our region here. So, all right, can you talk? And we're ready for you.
All right. Can you hear
So
me
you
now?
unmute yourself. You're on mute right now.
No, I'm still not on. Hold on. All right, can you hear
You
me
are
now?
currently on mute. Can you
No,
count?
it's unmuted. Can you hear me? There's an echo. All right, Anne, can you hear me?
I still can't hear you. Still can't hear you.
The audience can hear me.
So
Does that
it
work?
seems like I see you in the phone, but I also see you on the iPad. So maybe if you turn off your video, maybe you can turn off your video,
Turn this on.
and then I think there's something going on with perhaps with your audio. If there's the button of audio, you see the microphone?
Ann, I think it's yours.
Anne, I think it's yours.
All right, guys, we're still having technical difficulty with getting her.
Can you hear me?
I don't know how we.
The audience can hear.
I don't think I'm going to give this talk because I'm not ready to do it.
Oh, no. Hey, can you, hold on.
Okay.
Let me just try to.
Yes, I see her, but I can't hear you. All right.
Can you hear me now?
I still can't hear you. It seems like your picture froze.
Yeah, can you hear me now?
Can you
Can you hear
talk?
me now? Yeah, can you hear me? Can anybody hear me? Yeah.
Still can't hear you.
The audience can hear me. The audience can hear me. I'll text you.
Still can't hear you.
Okay, I'm going to text you. The audience can hear me.
All right, thank you for being patient. And if you have any questions, please type it on the on the chat while Dr. Conologue is getting on. Okay, very good. Can you somebody put in the chat so you can hear Dr. Conologue? All right, so one of our attendees says sign in and sign out again, Theresa.
Yeah, I just did that. Can you guys hear me?
I just unmuted you.
Yeah,
so
you're muting me. Unmute me.
usually I wouldn't have to unmute you if you're a panelist.
Yeah, it just said to unmute me,
Oh,
but
we did a dry run and seemed to be everything came
and it was
working out
fine.
well.
Okay, I know.
All right, how about if you sign in and only as audio and just do audio only,
Let me try that.
Theresa. Sign out and do audio. So okay, now sign in just audio only. All right, hang in there because she's got a lot of good stuff to talk to you about, especially taking care of your skin while you're wearing these masks. Okay, great. Are you on?
Okay, can you hear me now?
Theresa, can you talk?
I'm talking. Can you hear me? Can you hear me again?
All right. Can you talk?
Yeah. I am talking. The panelists can hear me. Look at your chat. Check your chat. Yes, I am. I'm here. I'm talking. Here and talking. Crap, what is wrong with this thing? It always works. Let me try it from my phone. I'll just try to, I'm going to log out of here. I'll try it on my phone.
All right. I apologize,
let me
but
try
we're
this. Hold on.
trying.
All right. Okay, hold on. Okay, can you hear me?
It says here to ask you to unmute yourself. You automatically kind of unmuted when you join.
Okay, how about now? Can you
All
hear
right.
me?
So I'm going to wait for her to join. So just when you join, just say something. Maybe we can hear you. I'll just read her slides for now. Let's
Oh, wait,
talk
I'm
about
here.
let's talk about care during quarantine. Avoiding breakout,
here.
hydrate. We know that stress as well as food, high in sugar and processed food, dairy can continue to acne. Avoid the
Just shut that
COVID.
off, Laura. How about now?
Cleanse your face twice daily with a gentle cleanser such as Ulta, Obagi, and Cetaphil. And I know that she has these in her office. So you stop by her office and pick up the Obagi. Use a non-comedogenic moisturizer and continue any prescription acne medicine. And this type of moisturizer, Ulta and Obagi are the best. This is a new breakout. There are a few over-the-counter products you can try, such as glycolic wash or different TM, which is a first-line topical use. And it's now over the counter.
Can you hear me yet?
It's on Amazon and Target. That's wonderful. So you guys write this down. Different and glycolic wash. All right. All right. How are you doing on getting audio?
I don't know. I'm on. I am unmuted.
Still can't hear you. I don't know what to tell you. It was working really well before.
Yeah, it was working just fine. How about now?
All right, guys. So hang in there with me. We'll figure this out.
Sorry.
Dry skin and skin irritation. Common for our skin to get dry and irritated. So especially hand washing and hand sanitizer. I can tell you that my skin are cracking. And I'm constantly putting on lotion on. I find that washing with cold water seems to help. So maybe you can try that. I wash my hand about probably 50 times a day before seeing a patient and after seeing a patient. And then now we have moisturizers. She said here, moisturizers are your best friend. Look for one with ceramide to repair the skin. And Elta and Serve is the one with ceramides. I have no idea what that is, but write down Elta and Serve. Add ointment base to help hydrate. So Aquaphor or plain petroleum jelly at night. That's wonderful. And also Elta melting moisturizer. I'm reading your slides. That's the best I can do at this time until you can figure out.
They can hear me, honey.
Until.
But Ann, they can hear
okay. Yeah, somebody, one of our panelists says, can you let the dermatologist speak? I'm trying to, but she cannot get connected to audio. All right, ask the panelists, can you type in the chat box?
I'm sorry.
Can you type in the chat box if you can hear Dr. Conologue?
Thank you. Okay, so I'm making a fool out of myself.
Interesting.
Thanks, Jean.
Interesting. Okay.
So
you can hear. Oh, you can hear her.
Yeah, that's what I've been trying to tell you. They can hear me.
I heard her before. Okay.
Yeah, I don't know why you're the only one that can't hear me.
But somehow I cannot hear her. All right. So everybody can hear Theresa?
Okay. Yes. I love it. Thank you. I'm glad I'm not losing my mind because I've been doing everything to fix this.
All right, Theresa, just talk.
All right, I'm going to talk. So, okay, so I'm going to talk.
All right, good. Theresa, just talk and I'll figure out if I can hear you. Okay?
Yeah. So just to go back a little bit, back to, we're focusing on skincare beyond when these masks come off. I mean, this isn't going to go on forever. We've got to start taking care of our skin now. I don't know about you all, but my skin has been breaking out like there's no tomorrow because of the mask and the heat. And I just wanted to touch base on a couple things you can be doing now. That's first. We talked way back about 3 slides ago about diet. I don't know about everyone else, but I've definitely been eating a little bit too many carbs and snacks, and that definitely affects my skin. The other thing is just routine. It's been very difficult. I know we have more time, but routines get out of hand. I'm much better when I have a schedule. So simple things. Washing your face twice a day. I know that sounds like a lot, but right now, if you're wearing a mask a lot like I am, it does help. Over-the-counter products, I wanted to make sure you guys had access to stuff. You don't have to come to my office and get things. I mean, I'm happy to, if you do. We have a lot of great products, but just facial products such as Different went over the counter probably about a year or so ago, and it's
Hey, Theresa, which slide are you on? Are you on this one?
one back.
One back. Okay.
Yeah, right there. That's it. Yeah, right.
Okay.
Yeah, keep going. Next slide. Number 2. All right. Okay, I'm gonna give you thumbs up and thumbs down.
I know.
Oh, this is just the dry skin one. So back to talking about your face, glycolic washes can be found over the counter and Different can be found over the counter. Both of those are very simple products. Different can be very irritating. It's for acne. It's cheap right now though. My goodness, it's like $14 at Target. So it's a great option if you don't want to leave your house, you want to get something shipped. You can use it at night before bed. Try not to put it on your skin if it's really wet, and that'll help if you're starting to get minor breakouts. The other thing that we're seeing is irritation from masks. We're not used to wearing these things on our face all day. And, people are getting breakouts from where the mask rubs, behind their ears. Hydrocortisone, this is another over-the-counter thing you can find. Hydrocortisone can be applied once or twice a day. It can help from just minor dry skin to irritation. So those are some great things just to kind of be able to do right now. Some of the things that we're also seeing is we are washing our hands more. I'm not sure what people were doing before, but we're definitely washing them more now, and using hand sanitizers. And hand sanitizers are extremely irritating. Look for 2 products. You want to repair the skin and you want to moisturize. There's actually 2 things you need to be doing. So repair lotions, Cetaphil, CeraVe. Elta has some great ones. We have them in the office. Cetaphil and CeraVe are over the counter. You're looking for a word called ceramide, and ceramide helps to repair the skin. And that will help with that chronic red irritation, kind of rebuild that layer that protects you from the environment in general. And then just hydrate, Aquaphor, Vaseline. So you want to hydrate. Oils, essential oils can be useful, but I like just simple. Aquaphor, plain Vaseline, Elta's Melt and Moisturizer, $13, one of the best things you can use. Aquaphor is like $7. These are simple, cheap products that'll really help. Okay, next slide. Next one.
Yep.
Next slide.
I can hear you now. So I can hear you now. So switch over to a different.
Fabulous. Okay, awesome.
Yeah, I just switch over to a different microphone. So we're good.
Oh, okay, great. All right, good. Okay, so sun protection. I know cabin fever is a thing. It's not even funny, and we want to get out there, and we want to get out there safely. So I always tell my patients rule of 3s: SPF 30 and above. Reapply it every 30 minutes, or reapply it 30 minutes before you leave the house, and then reapply every 3 hours. So if you can remember that simple kind of 3 things, that'll help you to protect your skin. And I am a big fan of sun protective clothing. Sun protective clothing can be found at Walmart, Bass Pro Shops. It's everywhere now. If you're a walker or a tennis player where you can't, you go out for a couple of hours and you can't reapply, these type of clothing can really, really help. And a lot of our athletic wear will have an SPF rating, and you can see it on the label. It'll be rated, SPF 30, SPF 50 usually. So that might be helpful also. I gotta move a little fast so I don't keep everybody. right, next slide. This is just the Ulta. That's one of the tried and true sunscreens. My personal favorite is the UV Clear. It's just doesn't get in your eyes and it works very well. Okay, next slide.
I wear this too. I love this.
Yeah, I love Elta. Johns Hopkins recommended that one. That's kind of like a staple for all dermatologists, and it works well. All right, so now we're going to get into some of the nitty gritty. Please don't forego your checks. We are open. We are open safely. Our rooms are deconned left and right. We have masks on. We're bringing patients in socially distancing. So please remember to do your skin checks. Don't put things off. If we catch these things early, 99% survival rate, even in melanoma. Melanoma is becoming more and more common. We see more of it all the time. And I think when I first started practice, I'm not going to say how long ago, but I think I had 11 cases total. And now we have, gosh, like 11 a month. That's crazy. So just be aware of that. We want you to look out and monitor your own skin monthly. You know, they tell you to do breast exam once a month. You know, look at your skin. Look for the ABCDEs. That's kind of what we preach. Asymmetry. Does the mole look asymmetrical? Is the border clean and crisp? You know, does it look like anything smudging outside of the border of the mole? Is the color uniform or is it kind of varied? Is the diameter getting bigger? And then evolving. You know, you had a mole your whole life and now all of a sudden you think it's changing. That's something we should be looking at. I have a slide on the next slide, I think, that shows some pictures. Yeah, here we go. So this is just some pictures. You kind of can look at these. I mean, these ones, of course, are obvious examples. But when in doubt, just have us take a look at it. You know, I tell my patients this one, that some things are just better off in a bottle. And that's not us in quarantine. That's some of these moles in your skin. So have a dermatologist take a look if you're worried about any of these things. But just remember that mantra, that A, B, C, D, E. And if you see anything like that, you know, obviously bring it to our attention. Next slide.
Well, this is a great picture. Is this it? Is this the next slide?
That's just, so I wanted to go over this one. I love this. And this one just shows the 3 different types of skin cancer that are most common. Obviously there's other skin cancers, but you know, these are the ones that we see the most. The most common in that group is going to be the basal cell, and I'll have a couple slides about that in a minute.
Wow.
Basal cells are not going to be someone's demise, but they can be very locally destructive. And if they're taken care of early, simple treatments. Squamous cells can be a little bit more aggressive. We'll talk about that in a minute. And then of course, you know, everybody worries about melanoma. And of course, that's a dermatologist's, you know, worst nightmare is having to tell someone that they have melanoma. But nowadays we're catching them earlier and earlier, and the survival rate is fantastic. All right, next slide.
So where is the distribution of the basal cell and melanoma and squamous cell? Where would you find that?
So
commonly?
just for common statistics, melanoma we find most commonly on the back of legs of women and on the back in men. Basal cells are going to be commonly on sun-damaged areas, so they love the face, they love your ears, oh, they love the neck where people forget to put their sunscreen. Women's chest, big time basal cell location, and then a lot of time backs of men. Squamous cells, again, sun-damaged areas, that I usually find in the scalp, ears, face, lower legs in women, anywhere there's been trauma or sometimes burn scars. But there's a couple slides on that too.
All right, so most of these are instigated by sun exposure? Most
of them. Melanoma can be a little bit different. Melanoma can be genetic. A lot of times it's a predisposition. And that, you know, we kind of recommend family members get checked. There are a lot of melanomas. Lenigo maligna in particular is from sun damage. But most of the melanomas that we pick up are not in sun exposed areas. That's why when we do our skin checks, I mean, people laugh that we're looking in your hair and the bottom of your feet and, you know, at your butt. But you have to. You can get melanoma anywhere and you might not know it. So it's just really important to have somebody either looking at you head to toe and just being conscious that you can have these things in just about any location. I have one patient with melanoma of the eye. I obviously didn't find that. It was found by his ophthalmologist, but he does his skin checks, but it can actually occur in your eye also.
Wow,
Next
oh, wow.
And
Hey,
this is
we
just me
both
telling
did
you, oh,
is this
I'm missing
Oprah?
stuff. Yeah, of course. Everybody get their body checked. This is my slide to tell you guys to come in. You know, get a look at, have somebody look at you head to toe. Make sure they're picking through your hair and looking in between your toes.
Uh-huh.
We could skip to the next slide. I forget there's something else on there. I think it just talks about how to do the skin check, but. Oh, risk factors. Every year at the beach, these people kill me. Fair skin, obviously. Redheads are notorious for having different types and sometimes more aggressive skin cancers. They have a different type of pigment in their skin. Too much sun exposure, chemical pollutants. People have been exposed to masons who are exposed to arsenic in the cement, nitrates, coal, tar. These kind of things can increase your risk. X-ray therapy for acne, I don't think anybody does that anymore, but I still have some older patients that had some radiation to like their chest and back for acne, and that has a high risk of skin cancer. Burn scars, your smallpox vaccination, I've had a number of basal cells in those. Chronic skin irritation, so, you know, lower legs where people have stasis dermatitis and, you know, they're not hydrating their skin and it's constantly breaking down. They tend to get skin cancers in those areas. Immunosuppression is an obvious one. And then there are some very rare genetic things. They're pretty rare, but they increase your risk.
Right. So how does what's a typical chemical pollutant that may precipitate skin cancer? Because I see most of these here like, oh, not something you would see in your typical everyday life. What would be kind of a common chemical pollutant?
No, we don't see these very often. I mean, like I said, I'll see them hands in particular for masons that are exposed to there's something in the concrete. I think they've removed a lot of these things. Some of these things are old. Coal and tar used to be used for certain skin conditions like psoriasis, that kind of things. We really rarely see these things very often anymore. Now it's sun, sun, and sun.
So
Mm-hmm.
How much sun is too much sun? Is anybody ever did any research on quantities of, all right, you have this many hours, 500 hours in the sun is way too much.
If you ask a dermatologist, any sun is too much sun. No, you want to live your life. I'm not going to tell people to become a vampire. That's not my style. But, you know, you want to be smart. It's just like this COVID. You want to be smart. You just, you know, don't be unnecessarily risky with your behavior. So avoid the peak hours. You know, we want to avoid the hours between 11 and 4. That's when the sun's strongest. That's when you're going to get the most rays. Stay in the shade. I always hear from people, I wore my sunscreen. Well, yeah, but you're out in the blazing sun all day. Your sunscreen's going to fail. It can't protect you that way. You know, you need to wear sun protective clothing. You need to find shade. And you need to watch those peak hours. And that's kind of the best thing you do. There's no rhyme or reason like, you know, if you get 2 hours of sun, you're going to get burned, you know, or someone else gets, because everybody's different. So I can't really answer that one, but be smart. Just be sun smart.
Yeah, you know, we know that men usually don't wear sunscreen, and they just go out, they do whatever they do. So does that mean that men have more skin cancer than women?
Yeah, you know, in my practice, I have way more male patients with sun-related skin cancers. Yes, I'd have to say yes.
Okay.
Oh, basal cell. So, you know, just to talk about what you're looking for in some of these skin cancers, the one thing I tell people a lot is it's the pimple that doesn't heal. You know, you get a pimple on your face, and it never goes away. You know, people come in, they're like, well, it comes and goes. I'm always getting it. It bleeds a little, and then it heals up, and I don't think about it, and then it comes back. A lot of times that's a basal cell. So that's something you want to get looked at. It can also be the patch of dry skin. I've had a number of people, chest, back. One lady had it on her butt. Patch of dry skin just keeps getting bigger and bigger, never goes away. It's a superficial basal cell. It can be there for years. Some of these people have them for 10 years and they just kept growing and growing. By the time, a lot of times the superficial ones get picked up on the chest and back, and someone who doesn't get routinely checked, they can be quite large, but they're still pretty easily treated. And then there's some rare forms. There's some scar-like ones, morpheoform basal cells. They're a little trickier. The one up in the right-hand corner box, that one that you can barely see, looks like a little scar. That's a morphiiform basal cell, and they're harder to find. But you know, again, anything bleeding, anything growing, anything odd, you know, just get it checked. Squamous cells, these are usually pretty. Again, you know, you want to consider it a non-melanotic skin cancer, but squamous cells can be aggressive. They can travel down nerves. There is some thought process of possibly staging these because ones that occur in the head and neck can be dangerous and can metastasize. You'd have to let them go for a while, but then, you know, there are types that can be a little bit more aggressive than others. Some of the most fast growing ones, there's a particular squamous cell called a keratoacanthoma. It'll crop up over a weekend. It really scares people, but that's probably the most easy one to treat and the least aggressive of them all, and occurs in very sun damaged skin. So they're usually easily spotted, but if you're coming in on at least a yearly basis, it's something that's going to get picked up and taken care of.
Interesting.
This is my last one. So wear your sunscreens. Don't become bacon.
That's the bacon. I didn't
Yeah.
know that's the bacon there. Yeah, that should be my husband. There. He never wears sunscreen.
Oh, mine too. I mean, we have sunscreen in every room of the house and at the front door, and you know, I've got to hound him to put it on.
Oh, hey, we made it. We got
Yes,
audio.
thank goodness. Thank God you can hear me.
I think something went wrong with my on my audio part. So thank you everyone that is participating and said that they can hear you. So
yes,
any questions? Anyone have questions at this time at all? So put it in the chat box if you have any question, and I'll check. I'll check Facebook here, see if there's any questions on Facebook. So apologize for the little technical difficulty before. You never know when you're doing this, you know, what happened in between. So I see 13 comments. Oh, wow. Okay.
Oh, wow. Okay.
Yeah. All right. Let me see if I can get that on here. All right.
Oh, I don't have them.
Yeah, I think I have them.
Okay.
And see. All right. Nothing yet. So we have so normally what is what cancer you should be really worried about? Is it melanoma or squamous?
Well, melanoma is the one that as a regular person you should be worried about. A dermatologist nightmare is the amelanotic melanoma, and not to we have enough fear going on, but that's a melanoma that doesn't have any pigment and can look pretty normal. It can look like a little red bump on the skin and almost look like nothing. And yeah, that's the one we lose sleep over. So, but melanoma is the most severe.
Melanoma. Okay.
Yes,
You don't want to get melanoma. So what happens when you are diagnosed with melanoma? Like what's the course of treatment?
Well, normally it's just an excision. I'd say 95% of my patients, it's just a re-excision with the standard margin. I mean, most of them we get in situ, which means it's in the top part of the skin, so it hasn't gone anywhere. And I operate on them right in the office. And you're awake, it's a simple procedure. So this is why we kind of emphasize, you know, please come in and get your skin checked. We want to catch these things early. Don't get me wrong, you know, there's that 5 to 10% of patients that, you know, they are coming in all the time and, you know, they just have aggressive forms. But boy, the odds of that happening are really low if we catch them early. Even if it has a little bit of depth, like just so even stage 1, that's still just an excision. Until they get really, really deep, we don't need to do any further intervention. When they do get past about a millimeter in the skin, we recommend surgical oncology, and they usually do a procedure called lymphocentesis, where a dye is injected into the skin. It is picked up by the first lymph node, and when they're excising the melanoma at the time of the surgery, they take that lymph node just to see if it's gone anywhere. But that's probably maybe 1 or 2 people a year. It's pretty far and few between, thank goodness.
Can you die from melanoma?
Oh, yes.
Yeah.
Yes.
I heard, But if there is death, what happened? Multi-organ failure? What are the causes of that?
It's usually, I've had a couple of patients. I've had one that went to her brain. She was undergoing gamma knife. We've had the one that went to her lungs. So yeah, it can happen. And you remember, I can remember every single one of them and their families. So yeah, it's,
So
I mean, I think I have like 5, but still that's 5 too many.
yeah. So can be prevented with just sunscreen? Was that what you're saying, or is there a genetic influence as well?
No, and some of these things have a genetic predisposition. There are some phenotypes of patient population that have these dysplastic moles, where they have a number of atypical moles, and that kind of puts them at a predisposition to getting melanoma. A lot of times it's not even in the mole that you have, it's the new one that crops up. So it can be tricky, but yeah, I'd love to say, wear your sunscreen, don't go out in the sun, and everybody's fine, but it doesn't work that way. There's people that are just predisposed to these type of things. And again, that's why if someone in your family has a melanoma history, you should be getting your skin checked, because it does put you at higher risk.
All right. So we have a question here. How do you get teenage girls to wear sunscreen? They check the UV index and only want to go out if it's high? That's the question.
They only want to go out when they're trying to get a tan? Is that the
yeah, right. I think so.
You know how I harp on, harping on the young is difficult, because they're not going to buy the skin cancer proposition. You got to tell them they're going to age. Same thing with smoking. They're going to get wrinkles. Yeah, you just have to show them pictures of, there's a couple on the internet. There's one of twin females. One, lived in the city, never got out, and the other one grew up on a farm, and God, the one looked 90 and the other one looks in her 40s. So harp on the wrinkles, that seems to help a little bit. But yeah, they're tough, because, you're invincible at that age.
So is it worthwhile to probably show those pictures that you have?
I don't have, well, yeah, I can, yeah. I'll add them to the page. I don't have them right here. Good gosh.
Yeah.
But yeah, that's what I tell my younger patients, that they're going to get wrinkles. They're going to age prematurely, and that sets in a little bit, but yeah, you got to harp on them a little bit. I always tell people too, if you put your sunscreen next to your toothpaste, and if you get them something that they like, that doesn't, that's why I said SPF 30 and above. You don't want that thick stuff. No one's going to use it. It doesn't feel good in your skin. You're not going to use it. So you got to get them something that they like, something that's easy to put on. And I even tell this because men are just as bad. So I tell my male patients, just stick your sunscreen next to your toothpaste by your toothbrush. Remember to put it on in the morning before you leave the house. And that tends to help a little bit too. But there's studies on teenagers, even with acne treatment, that the only time they start using their medication is about a week or 2 before their derm appointment. So they're tough.
So they don't get yelled at. Is that right?
Yeah, exactly.
Right. So let me see if there's any other question. Oh yeah, I wanted to ask you, why are we catching skin cancer early? What are patients doing that's making a difference?
Well, I think it's more common now. Even back when I first started practicing, it wasn't as common as what we're seeing now. And I think education's out there, and dermatology has become a little bit more mainstream. It used to be not everybody went to a dermatologist, and now I think it's more, most people are getting skin checks, and I think that's why. Yeah.
All right. So essentially check everywhere in your body. Just don't check what you can see, because you don't see anything in the back. Right.
Well, have one of your family members have your back. There's just have someone take a look if they can. If not, I'm happy to take a look.
Now, how often should you go to a dermatologist?
So without a skin cancer history, I usually recommend once a year skin check. If you have a skin cancer history, a lot of times we see it twice a year. It really just depends. But for the average person, just, starting out the gate once a year is quite enough.
Okay, once a year.
Mm-hmm.
All right, everybody. Hope you hear that.
It's pretty physical.
We have a question from one of our attendees. Are cosmetics that contain certain SPF effective?
Oh, that's a great question. Yes, I get this one a lot. No, So you want a sunscreen underneath, because if you're using your makeup as your sunscreen, I don't know about you, but you're not putting it on all, as thick as you need it for that to be an adequate SPF. So find a sunscreen that's a lotion that you can put on first, and then put your makeup over that. A lot of the newer sunscreens out there, especially, some of the ones that have like kind of a silky texture, they kind of make your makeup go on a little bit better too. So, but yeah, don't buy it. That's not good enough.
So put sunscreen after your moisturizer, or put the sunscreen on
No.
first and then moisturizer?
I personally use my sunscreen as a moisturizer. So I get that UV Clear from Elta. I love that one. And I use that first, and it kind of hydrates my skin, and then I put my makeup on over the top of that, and that works quite well.
All right. Well, that's a great question. Yeah, because
yeah, it's a good one, because I do get that a lot.
That's right. Because like a lot of primers have SPF, or foundation has SPF, and you're thinking that's protecting you, but it's not. You should still put your sunscreen on.
Yeah, it's just not enough, and they're not designed. I mean, they're designed as a promo into the makeup. I mean, it's kind of like a selling factor. It's not necessarily designed as a true, protectant.
So how about wearing hats when you go out in the sun? Is that a protection? But is that enough without sunscreen? If you wear like a wide brim hat, is that enough?
Now, I would always, always protect your face. I mean, if you're wearing sun protective clothing on the body, which, that's adequate. Make sure you get the back, protect sunscreen on the back of your hands. Protect your face. Even with a hat on, there's no way. I mean, unless you're sitting still and you have definitive pure shade, and it's an SPF hat too, that the hats are SPF rated also, you're not getting full protection. So always, always, always protect your face. You only get one skin. Get one shot.
All right. It's another question here. Another one here is, are there sunscreens specifically for lips?
Yes. Oh, yes. Actually, there are. So Aquaphor, the General Aquaphor has one. It's a moisturizing sunscreen. Again, to harp on the Elta, it's a good line, but Elta has a great one. But yes, there are sunscreens specific for your lips. The other thing to point out is, so that's a kind of a good leading question, is glossy, if you put lip gloss on or anything oily or shiny, that actually attracts the sun. So you want to be careful with anything very shiny that doesn't have a sunscreen. If it's shiny with a sunscreen, that's a different ballgame. But just plain old, your good old lip gloss stuff, and you're out in the sun, that will actually reflect more sun onto your lips.
Oh, so so you shouldn't be putting like petroleum jelly or something on your lips, or
not without an SPF in it. Yeah, if it has SPF, which they're, like I said, the Aquaphor, you can find that in the drugstore. That's a good one.
Okay, good. All right. Anyone else have questions at all? Those are very, very good questions. Let me check Facebook. Nothing at this time. Hi, Anne. Anne is on, our tennis player.
Hi, guys.
Well, finally, yes. I think we're at the top of the hour, and I apologize for the little technical difficulty.
Sorry, guys.
So I think it was great. Works great when we did the test and everything. So sometimes things just happen, but we made it through, and we got it through. We got great information, and I certainly learned something every day, and I'm much appreciative, Theresa, for being on with me today.
Well, thanks for having me. It was lovely.
Yeah, and I hope that all our attendees learned something. I know I did. Got to put that sunscreen on no matter what. Even I'm a little lazy. When I'm going out playing tennis, I should be splattering it on, right?
Yes. I'm always looking.
And well, you know who to go to for sunscreen when you're playing tennis now.
Yes. I always have the good stuff too.
I know. You gotta go to her to get your sunscreen. But thank you very much for spending the day with me, and thank you everyone for being here. We'll see you next week again. All right.
Okay. Thank you.
Good night.
Thanks, everybody.